Good afternoon, everyone, and welcome to today's webinar, Election 2020, Public Health Legal Reforms and Projections, brought to you by the Network for Public Health Law and the American Society of Law, Medicine, and Ethics. I'm Charles Trong, the Senior Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. We strongly encourage attendee participation and would love to hear from you, so feel free to submit questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is open up that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing your questions at the end of today's event. Your moderator for today's webinar is Leela Barraza. Leela is a senior consultant at the Network's Western Region Office, as well as an assistant professor in community, environment, and policy at the Zuckerman College of Public Health at the University of Arizona. She'll be leading us through the rest of today's webinar. So Leela, over to you.
Thanks, Charles. Welcome, everybody, today for joining us. I'm really excited to hear our great panel of speakers that we have today for this webinar. My name is Leela Barraza. I'm a senior consultant with the Network for Public Health Law. And as mentioned, I'm going to serve as the moderator for the presentation today. I'd like to introduce our three great panelists. First, we have James Hodge, the director of the Network for Public Health Law's Western Region Office. Also a Peter Kiewit Foundation Professor of Law at the Arizona State University College of Sandra Day O'Connor College of Law. We also have joining us today Jennifer Pyatt, a senior attorney with the Western Region Office of the Network and a research scholar with the ASU Center for Public Health Law and Policy. And last but of course not least, we have Sarah Summers, managing attorney with the Southeastern region of the Network for Public Health Law and with the National Health Law Program. So I'm excited to share this webinar with you because we have such great panelists and such important information to share on the Election 2020 Public Health Legal Reforms and Projections. We have a few primary objectives to start for this webinar. We're going to talk about some post-election results, focus on some really core public health issues, challenges and objectives, and law and policy responses related to those core public health issues. And we want to make sure to leave time for questions and comments. So we will make sure to do that, and I will moderate the questions and comments as we go, and we'll answer them at the end. I also want to share a quick disclaimer. We, in this webinar, are not providing any legal advice, or do we intend to promote any specific legal or policy position. So Election 2020, a historic election, a presidential race. We, as you all know, we had Trump-Pence as the Republican ticket for president and Biden-Harris as the Democratic ticket. And we had voter turnout was at record levels for this historical election. And to note, part of the history of this election as well is Kamala Harris as the first woman, first Black, first South Asian American vice presidential, or vice president-elect. And in addition, here we have the race of what we've seen. We know there's a couple states that have not been polled quite yet, but this is where we currently stand with Joe Biden with 290 electoral college votes and 214 for incumbent Donald Trump. We are going to continue this webinar with these facts as Joe Biden as the incoming presidential president. And to note, this election 2020 really goes beyond the White House. It wasn't just a race for the White House, while that was quite historic. It also involved House of Representative races, Senate, gubernatorial races, and races for many state legislatures across our country. So this election had wide impacts across this country. I really want to touch on the reasons for this webinar and for what we are going to be discussing today as relating to some key public health priorities. And part of that stems from some polls that were done around the election. This one was mentioned in the Wall Street Journal, and it asked people what were the factors that most influenced their vote. And you can see here COVID-19 was a large majority of that impact, 40%. But if you look at all the other factors, 70% are core public health or healthcare issues. And that had a key influence on how voters portrayed their vote and how they decided to vote on election day. We recognize there are an array of public health law and policy issues related to what could be coming in the future. All of these are of utmost importance, but due to time constraints, we really needed to have to focus it down to a few. So while we recognize all of these and more as vital issues, we had to narrow it down in the interest of time. And these are the 8 select core public health law and policy issues that were chosen for this webinar. Just to briefly go through them, we have COVID-19 pandemic response efforts, revitalizing public health services, gun violence prevention, abortion and reproductive health, climate change, health equity and justice, and to close us out, Affordable Care Act and Medicaid, all key issues that will be discussed today. And since I want to make sure we do have time for questions, I'm going to quickly pass it over now to James Hodge to start us off with the first 3 of these key legal issues.
All right, Leila, thank you so much. And listen, these topics are impactful and profound. We're going to be able to raise just so many different observations in relation to these critical issues as Leila laid out among these top 8. But to be sure, we do look forward to hopefully hitting upon many of the salient issues that may be forthcoming as far as critical law and policy changes in the next year or 2 or 4 ahead. And to that end, I think we all know, as you saw from that brief sort of polling chart and what we've been sensing and basically assessing across the nation, COVID-19 and our national response to it was a big factor in relation to election outcomes, not just at the presidential level across the states, across multiple different races. COVID-19 and how we respond in real time has been a critical factor. Where do we stand in relation to it? The numbers are absolutely and continue to be profound. So much so what you're seeing on screen on the left side is almost already a dated snapshot of where we are with prevalent cases. Even the data you see in relation to the numbers of U.S. cases compared to the global cases. Gosh, even on the weekend, 246,000 deaths now, an additional 4,000 just over the weekend alone. One of the most compelling stats is just how big of a response effort and failures at the national and state and regional levels we've had to experience in the United States. When you look at the total percentage of all deaths and all cases, 20% around that average for the last several months focused in the United States, even though we have 4% of the global population. That's unbelievable. It's what and how President-elect Joe Biden has so much characterized us as heading into a dark winter. We have profound new rises in cases. We have deaths ranging in the neighborhood of around 50 deaths per hour in the United States. During the course of this webinar, we may lose 50 more Americans to COVID-19. It's the most profound public health challenge we can imagine. It looks dark and bleak. We've got multiple pharmaceutical interventions coming forward in so many different ways. We also have an upside, and that upside extends to what we might see as law and policy responses and changes to those significant challenges that COVID-19 has presented for us. Now, to be sure, one of the things that you're already seeing in President-elect Joe Biden's plan for how he'll address COVID-19 is a reinstitution of public health best practices. We're talking about the things we know have worked well over decades, grounded in law, grounded in science, grounded in global commitments. And I think that's a real sort of barometer of what to expect, not just at the federal level, at the state, local, tribal levels as well. You will see an enhanced and aggressive federal response, too. President-elect Biden's plan in response to COVID-19 is considerably more aggressive. There are things that we expect we may see done at the national level that we've never before seen in the United States. all designed to tamp down this horrific pandemic in the United States specifically and globally as well. There will be a prediction of increased funding and global and domestic public health related initiatives. This is being called for nationally at every level of government, within the private sector. The demand for funding, I think, is an upshot from this sort of post-election situation. And one of the really critical factors here, I think you're going to see a sort of change in the alliances that have been sort of crafted and created with state, tribal, and local governments on the front lines of response efforts. What do I really mean by that? You're going to see new alliances grounded in the best outcomes based on the best science, with new funding, hopefully, and a new appreciation for how we can align these specific strategies. All hopeful, quite possibly, but on the upside, yes, I think we're going to see COVID-19 in our rearview mirror sometime in 2021. It all ties into so much of what we're seeing with COVID-19, into this sort of revitalizing of public health services. Hey, listen, the challenges are profound, obviously, as you've seen. Substantial new threats, chronic funding reductions, the interjurisdictional battles that have been just really outstanding over the last multiple periods of time, the gross inequities that we're seeing across our public health system and healthcare delivery, all leading to something we've documented well and repined on in specific places, considerably lower life expectancies, specifically for Americans. Now, here's the real kicker about this slide. I could have drafted this before COVID. These are the types of challenges we were seeing arising to our public health system and healthcare delivery in the United States over multiple years, not just related to COVID. How do you revitalize public health services using law and policy as an essential tool? Well, you do the types of things that we learned works best, not just pre-pandemic, but during the pandemic. Quelling the pandemic is leading to legal innovations right now. And those legal innovations really will become models for what works in routine public health and healthcare services. So there's things we're doing legally that we've not been doing before, designed to quell this pandemic, and we're learning quickly in real time. They actually are going to work long term, even in routine-related situations, for how we can revitalize public health services. The new appreciation for the zero-cost situation, the new appreciation for how we distribute health services quickly through telehealth, how we distribute resources rapidly in ways that we've not had to do at this level before. It all plays well into the law and policy responses for what we can expect, I think, in a post-election environment. We are also engaged in the biggest, widest, most systematic sort of reassessment of the constitutional balance between what communal and what individual interests underlie the specific pandemic. We are developing 21st century reconception of public health powers along the way. What we're authorizing public health authorities to do, what we're expecting from them in relation to their sort of working in and around other specific divisions of government and with private sector, these are we have just not seen these at this level in the past. I think you're going to see continued additional advancement along those specific things as well. That new constitutional balance decidedly shifting in favor of protecting the public's health. And then we have specific threats that remain. They continue to be profound. Threats like cancer and Alzheimer's, illicit drug use, and some of the things Leila pointed out on that specific screen just a few moments ago. We've got every chance now to revise law and policy interventions, particularly honed in on a health and all policies approach. Perhaps this new administration will bring to the forefront yet again in the United States. We have new opportunities to actually address these specific types of threats, even in a post-COVID environment, once we put our mind and set to forming law and policy responses that we know will work for the specific type of interventions. And then you're seeing finally a commitment to reducing health disparities. Now, this cannot be more easily stated in response to what you're seeing with COVID-19. It's profound and it's difficult to actually assess fully how distinct these health disparities are. We are prepared and honed in, focusing on social determinants of health as the new mantra for how we're actually going to improve public health in the United States and globally for the 21st century. COVID-19 is revealing it. Some of the solutions are coming from it. Gun violence prevention, the challenges here, we highlight them because they remain some of the most significant legal and policy challenges that can be drummed up in the United States. Very clearly, we are working up against the backdrop of gun violence-related issues that are not just, obviously slow-moving. They've been occurring for multiple years and decades now. The Second Amendment's been the bastion of how and why we can't act sufficiently in this specific arena. We've seen federalism-related debates on that. We've seen the U.S. Supreme Court take on and then only just earlier this year actually rejected a case, New York State Rifle and Pistol Association versus New York City, after some of the facts and terms out of that specific decision fell away. The court was declared moot. But to be sure, this debate that's ongoing between Second Amendment protections and what we do to eliminate gun violence as a fundamental threat is significant. And to be sure, we will not definitively in any administration address all of the critical themes you're seeing on screen. We might be moving in these directions about banning the manufacture and sale of assault weapons, heavily regulating those specific weapons already in circulation. President-elect Joe Biden has already mentioned this as a direct intervention. Ending online purchases of firearms and ammo and requiring background checks for all other sales. It only makes sense. It's a fundamental platform that President-elect has set forward and exists within his campaign promises. Incentivizing states to enact their own laws, supporting federal initiatives. This isn't always going to be resolved at the federal level. Certain things can. States will increasingly, hopefully, get into the game with the backdrop of federal support. And then most importantly, a critical theme we've seen, and actually I think our colleague Jen Pyle will discuss a little further too, and we've got to empower police to enforce gun violence prevention laws at a much higher level, especially related to domestic abuse situations. But to be sure, we've also got to assess and re-examine how we actually reform police services in the United States to make sure unwarranted acts of violence occurring against Americans is not part of our profile going forward nationally. There's a lot of material there, and I'm really pleased to get some of that out. We'll look forward to questions and comments. For now, let me turn it over to my great colleague, Jen Pyle.
James, and thanks very much again to everyone who's joining us here today. I will be focusing in on three key topics during my portion of the presentation: abortion and reproductive health, U.S. approaches to climate change, and health equity and justice. Now, abortion and reproductive health is a topic that was heavily discussed in the lead up to the election and indeed made up roughly 3% of that initial pie chart we saw in terms of being a factor that most influenced voting decisions. In September, of course, the country lost a brilliant jurist with the passing of Justice Ruth Bader Ginsburg. And just a few short days before the election, President Trump's appointee, Amy Coney Barrett, was confirmed to the court by a divided Senate. In determining the potential future for abortion rights with the new super conservative majority on the court, individuals are waiting on the first reproductive rights oral argument and opinion to really take the temperature of the new makeup of the court on this important issue. There is a petition for cert pending in the court in Mississippi case Dobbs versus Jackson Women's Health Organization, involving a 15-week ban on abortions in the state of Mississippi. And whether and how this case is taken up and decided by the court could be a good indicator of what else is to come. So what are some potential approaches to protecting abortion and reproductive rights in the face of this uncertainty? Well, it may depend in part on the Senate with respect to the first two of these approaches. First, President-elect Biden has indicated a willingness to codify Roe versus Wade and progeny, currently under threat in the Supreme Court. Second, President-elect Biden supports repealing the Hyde Amendment, which is a rider that has been continuously approved by Congress since 1976. The amendment bars the use of federal funds to pay for abortion except to save the life of the mother or in the event the pregnancy arises from incest or rape. These two actions would clearly require Senate support. That said, without the Senate, President-elect Biden could take executive actions to revoke two policies impacting abortion rights, both domestically and abroad. First, President Trump re-implemented the so-called domestic gag rule. And what this does is prevent federal funds to be used by federally funded Title X family planning centers if those centers perform, refer for, or even consult regarding abortion. This policy caused many centers to leave the Title X funding program in favor of providing complete information to patients. Revocation of this policy could certainly expand access once more in this program. Finally, President-elect Biden could also rescind the so-called Mexico City policy, which prevented federal aid to organizations in developing countries that offer information on abortion services. And rescinding both of these policies could have profound impacts on access to abortion, both domestically and globally. I'll next turn to climate change and U.S. responses. According to NASA, global temperatures and ocean temperatures are rising at an alarming rate, causing shrinking ice sheets, glacial retreat, decreased snow cover, rising sea levels, and record numbers of extreme temperature events. In fact, the 5 warmest years from 1880 through 2019 have actually all occurred since 2015. The potential results here are disastrous. Sea levels rising between 10 and 32 inches by the end of the century, hurricanes becoming stronger, floods and droughts becoming more common, severe heat waves becoming unbearable, less fresh water available as glaciers melt, and increased spread of mosquito-borne diseases like malaria, among other consequences. These all await a future in which climate change is not addressed. But there are several challenges ahead for a Biden administration. A divided Congress, again, could delay passage of any climate change legislation. Additionally, the vast majority of the cost of the action will fall on a vocal and politically powerful minority, fossil fuel companies, among others, opposed to action. Additionally, with a new conservative supermajority on the Supreme Court that may be inclined to disfavor government regulation, challenges to regulatory actions could stymie Biden's ambitious $2 trillion climate change agenda. But there are some potential approaches in this sea of challenges that may appear in the next administration. First, President-elect Biden has made clear his plan to rejoin the Paris Agreement on his first day in office, a 2015 agreement with long-term goals, including keeping the increase in global average temperature to below 3.6 degrees Fahrenheit. Each party to the agreement has to regularly report its contributions towards this long-term goal, and by rejoining, President-elect Biden could be signaling U.S. posture to the rest of the world. Additionally, in the same diplomatic vein, President-elect Biden has indicated a desire to demand a worldwide ban on fossil fuel subsidies. Furthermore, President-elect Biden proposes taking a much stricter approach to regulatory enforcement than the current administration, proposing to ensure that the EPA and the DOJ prosecute pollution cases to the fullest extent of the law. Finally, President-elect Biden would seek to consider climate change in federal permitting actions and in all infrastructure investment to ensure that moving forward, this threat remains a focus. Finally, to conclude my session with all of you today, I'll turn to health equity and justice. Now, this is a broad topic indeed, but health equity implies that ideally, everyone should have a fair opportunity to attain their full health potential, and no one should be disadvantaged from achieving this potential. And most importantly, achieving true health equity requires recognizing that some populations will require greater and/or different resources than other populations to ensure access and improve health outcomes. As the graphic on the slide illustrates, simply providing the same supports to everyone, a pure equality-based approach, will not truly achieve health equity because some populations start from behind and need more supports in order to catch up. There are significant challenges in the way here. First, it's clear that the political pendulum swings both ways in the United States, and though sometimes it swings toward health equity, sometimes it swings just as heavily away from it. President Barack Obama's first term in office provides a great example. Elected in 2008 with a full House and Senate of his party, President Obama attained one of the most important pieces of legislation in the health equity arena, the Affordable Care Act, passed in 2010. That same year, in the midterm elections, opposition to the Affordable Care Act helped cause the pendulum to swing, resulting in a Republican House at odds with the Democratic president. Now, these swings will certainly pose a challenge to a Biden administration. Furthermore, Senate control of the purse could impact any actions taken, as President-elect Biden will need cooperation to get needed funding. Finally, underrepresentation of affected groups in positions of political power stifles those viewpoints and stifles growth. We have just witnessed the historic election of the first female vice president, the first African American vice president, the first South Asian vice president in the nation's history, all in this same election. But there are many other positions of power where these viewpoints are sorely needed to drive change. So how can these challenges be faced head on? First, President-elect Joe Biden has a unique opportunity to install appointees who represent groups most in need of improved access in order to ensure that those viewpoints are represented at all levels of government. Additionally, President-elect Joe Biden has indicated a desire to implement a health insurance public option, as well as to focus in on the maternal mortality crisis in the United States, which disproportionately affects African American women. Third, President-elect Joe Biden is in favor of doubling investment in community health centers and increasing the federal minimum wage to $15, both actions which can improve the social determinants of health. Finally, President-elect Joe Biden has indicated a plan to rescind President Trump's executive order that banned implicit bias training in the federal workforce as well as by federal contractors, acknowledging instead that systemic racism exists and is a deterrent of health, and that implicit bias training is necessary in order to move towards a better understanding and therefore a better future. And with that, I will go ahead and turn it over to Sarah Summers, who will discuss our final topics. Over to you, Sarah.
So today I'm going to be talking about the Affordable Care Act and Medicaid and what is on the horizon. And so in order to do that, let's go back and review where we've been with the Affordable Care Act. As everyone knows, the Affordable Care Act was passed in 2010. And from the moment it was signed, it's been besieged from a variety of fronts, from challenges from legislative, judicial, and political. Yet it marches on. And we will see what the next year brings, which will be a key one for the ACA. Basically, the Affordable Care Act was subject to lawsuits from the moment it was filed. There were more than 100 lawsuits filed within the first couple of years, and they continue to be filed. They've been of varying intensity. Some of them have been existential threats to the ACA, others have been nibbling around the edges, others have been ineffectual. At the same time, the legislature, the federal legislature, when it changed from Democratic control, there were multiple attempts, as everyone remembers, to repeal the Affordable Care Act that ultimately were unsuccessful. In addition, once the Obama administration turned it over to the Trump administration, there were a number of threats from the administrative and executive branch. Those include failing to advertise for the open enrollment periods into the marketplace, failing to provide funding in some cases, and other ways issuing guidance that undercut some of the central parts of the Affordable Care Act. And then finally, the states played their part. While some states wholeheartedly rushed into the Affordable Care Act, others held back and actively tried to undermine it. So with that, we will go and talk about the responses that we can expect to see coming up. So first, let's talk about the courts. I think probably all of you public health types were watching the media last week where they had the arguments in the U.S. Supreme Court case of California versus Texas. This is a case in which the state of Texas, joined by a number of other states, argued that the Affordable Care Act's individual mandate was unconstitutional, that it should be struck down, and with it, the entire Affordable Care Act should fall. This may sound familiar. You may remember National Federation of Independent Businesses a few years ago where they made the same argument. The individual mandate survived as a tax, but it was zeroed out by the legislature, so there's no longer any financial penalty for not having insurance. But what the states argued was that without any money attached to it, without a financial penalty, it was no longer a tax, and therefore Congress didn't have the power to enact it. to the surprise of court watchers, that was successful at the district court. And the district court in Texas not only said it was unconstitutional, but struck down the entire Affordable Care Act. Jump up to the appeals court. The Court of Appeals said, yes, it's unconstitutional, but you need to determine which parts of the Affordable Care Act can fall or stand with the mandate. Meanwhile, it went up to the Supreme Court. A number of states intervened to defend the Affordable Care Act, including California. And during the Trump administration, the Department of Justice made a remarkable about-face and attacked the Affordable Care Act instead of defending it. So we had the interesting experience of having the U.S. Solicitor General arguing to strike down a federal law. So what is going to happen in California versus Texas? Everyone, every court watcher cautions you, don't pay too close of attention to the argument. But you can't help yourself but to try to read some tea leaves and see what might happen. It seemed from the tenor of the arguments that one of the things that the court was having the biggest problem with was the idea that the entire Affordable Care Act had to fall if the individual mandate did. It's a concept called severability, and there is a strong presumption that laws are severable, meaning that if one part of it is struck down, then the court should do their best to preserve the rest of it. And really with the Affordable Care Act, that is particularly appropriate. Because not only does the Affordable Care Act have private insurance market reforms, like the requirement to hold insurance, protections against discrimination based on pre-existing condition or other characteristics. It also included a Medicaid expansion, which I'll talk about in a minute. It included a number of reforms to the public health system. It included a permanent reauthorization of the Indian Healthcare Improvement Act, just a wide variety of things that have nothing to do with the individual mandate. And it not only would it not make sense to strike them down, it would be horrendously disruptive. What's interesting about all the litigation at the Supreme Court is the number of friends of the court or amicus briefs that are filed. And there were 140 amicus briefs filed in the National Federation of Independent Businesses case, the first attack on the individual mandate. And with California versus Texas, there weren't quite as many, but still a good number of them. And what's striking is that some of the previous foes to the Affordable Care Act now came out to support it as friends of the court because of the disruption it would cause if they struck down the marketplace reforms, the Medicaid reforms, and a number of others. So we can expect to see a decision coming out with something big and controversial like this. They usually tend to come out towards the end of the term, so probably late spring or early next summer. So watch this space. So the executive branch, that's where we're going to see a 180-degree switch. Instead of doing what they can to undermine the Affordable Care Act and to get rid of it, we now are going to have President-elect Biden and the team that he brings in, strong supporters of the Affordable Care Act. So what we can expect to see is renewed promotion and support for the Affordable Care Act to get people to enroll in health insurance and to publicize the options that people have available. There will be, without a doubt, new regulations and guidance explaining aspects of the Affordable Care Act that need to be improved or explicated. Some of the regulations that came out that were problematic for the Affordable Care Act will likely be rescinded. And then when there are lawsuits against attacking the Affordable Care Act, we assume that the new Department of Justice will wholeheartedly support the law and be there in court to defend it. So Congress. For Congress's part, it seems like we're probably going to see a status quo. We still have the Senate controlled by the Republican Party. We still have the House controlled by the Democratic Party. And that's where we were at sort of a stalemate for several years before the administration changed. What this means is that it's unlikely to see legislative reforms. Almost everyone who is involved in health policy agrees that the Affordable Care Act could use some improvements. It could use some tweaking and refining and try to address some of the problems that persist 10 years into the law's life. It's unlikely that there's going to be a lot of progress in that area, at least in the next 2 years. On the other hand, it's unlikely that there are going to be more attempts to repeal it since that didn't even succeed when the Republican Party controlled all branches of the government. And finally, we have the states. Again, it's the status quo. The decisions around the Affordable Care Act, whether to have a state-based marketplace or use the federal marketplace, whether to expand Medicaid and a number of other provisions, depends on the state. In most cases, the power is with the legislature. In some cases, the power is with the governor. Pretty much, they stayed the same. So it's unlikely to be a lot of movement there. The exception might be developments with Medicaid. And so I'll move on to this, my next topic, Medicaid. So Medicaid is the 65-year-old health insurance program that covers low-income people and some people with disabilities. The Affordable Care Act required states to expand to all citizens who weren't otherwise covered under 138% of the federal poverty level. The aforementioned National Federation of Independent Businesses case from the Supreme Court made that expansion optional. So what we see now is first a rush of states to expand and then continuing with the trickle. And today, 39 states, including the district, have expanded Medicaid. And not adopting it at this time are 12 states, including most of the states in the South, including my home state, North Carolina, where I am right now. And I will point out something about Wisconsin. Wisconsin has a kind of a Medicaid expansion, but it's not a full expansion. It enables some people to get expanded Medicaid and others to buy into the marketplace with bigger subsidies. That's why they're still in orange. So so that's one important aspect of Medicaid that's subject to change. There are a variety of other aspects of Medicaid that have seen a lot of developments during the Trump administration. One of them is the encouragement of states to request permission to make exceptions to the Medicaid rule to operate their programs. This includes states imposing higher cost sharing or co-payments or requiring payment of premiums, which is limited under Medicaid. It includes states making delivery system reforms like managed care. And most notably, the Trump administration has encouraged and authorized states to impose work requirements in exchange for being covered under the expansion. And so I'll move on to what we can expect to see coming there. The threats and opportunities remain basically the same. They mirror those for the Affordable Care Act. If indeed the Supreme Court decides to strike down the entirety of the Affordable Care Act in California versus Texas, that would strike out the Medicaid expansion along with it. That would mean that 12 million of the 68 million people getting Medicaid would no longer have coverage. In addition, it would undermine a number of other important Medicaid reforms, including the streamlining of the eligibility and enrollment systems, expansion of coverage of preventive services, including reproductive health services, and just causing extreme disruption in the healthcare market, which would do nothing to help the clinics and hospitals and providers who use Medicaid. With the executive branch, again, it's going to be an about face. Support for the Medicaid expansion, encouraging states to expand, and to reverse, it is in all likelihood, they will take the position the Obama administration had and say that work requirements and block granting Medicaid, meaning giving the states a finite amount of funding to operate their Medicaid programs, are very likely to be a no-go. There may be steps taken to reverse the work requirements that have already been granted. As some of you know, there have been successful lawsuits filed to halt the work requirements. So right now they're on hold. The Supreme Court is considering whether to hear a lawsuit, to grant review of the lawsuits finding the work requirements invalid under the Medicaid Act. The executive branch, they may take up where the Obama administration left off and keep pursuing delivery system innovation in Medicaid. That was a very active and dynamic part of the Centers for Medicare and Medicaid Services during Obama to experiment with better and cheaper ways to deliver care. And so it's likely that they'll take that up again. In general, and this goes beyond Medicaid, President-elect Biden had talked about his plan not to have Medicare for all, but to operate a public option that would operate alongside the private market and would enable people to buy into it instead of on a private plan, which would also include a federal option for expanding Medicaid that would include people in states that didn't expand Medicaid. So with Congress and Medicaid, disappointing that there aren't opportunities to make improvements and to expand. But if Congress had been completely controlled by the Republican Party, it's very likely the entitlement to benefits might have ended. There might have been just a lot of the safeguards and protections and guarantees of Medicaid would have become optional, and it would have become a much more patchwork type of program, the kind that the Medicaid Act was enacted to reverse. And with states, once again, it's a mixed bag, basically the same political composition. One very negative is that budget crises are impending in almost all of the states because of the economic downturn due to the pandemic. On the other hand, we've seen that even some very states where the legislature and governor were adamantly opposed to expansion, they've been able to expand through ballot initiatives, Missouri and Oklahoma being the most recent, very red states to take that option. Not all states have that option, but those that do are very likely looking in that direction. So I'm going to pass it to the question session, and then I, like the rest of us, will be here to answer more questions about those topics.
Thank you so much, all of you. Those discussions were amazing and so informative. And we have some great questions coming in right now through the chat and through the Q&A. I think, here we go, there are the instructions if you need those again on how to submit your questions. But to start, I have a question. This really could be for any of you on the panel, but I think I'll start with James. What should be our single or primary public health message in 2021 with the incoming new president, and who should deliver that message?
Wow, I love that. Well, first of all, hopefully the network, because law will be absolutely essential to what we accomplish in the public health arena in the next 4 years ahead. That part we really want to cement and sort of idealize, and sort of memorialize. But the great part of that question is, what's the new leadership? What's the new model? Who should we be turning to for that? It's going to be a revitalized CDC? Is it going to be a new role for the U.S. Surgeon General? Is it going to be a president that actually speaks language and best practices and the science underlying public health at the level we need for the purposes of some of these significant accomplishments? Or will it just be persons in the know who are actually influential, and people like Dr. Anthony Fauci or otherwise? Hey, how about a combination of all of them plus all of us across the state and local levels, aligning in relation to how we think about the role of public health in a post-COVID sort of environment? It will be a stronger, more intricate part of people's lives they hopefully fully appreciate more than they ever have before, because we've all experienced what public health breakdowns or other concerns lead to. Excess deaths, excess morbidity, all preventable, subject to a true alignment in relation to how we think through these topics at every level of government. That's my 2 cents worth, but I'd love to hear from additional panelists to that effect.
Jen or Sarah, did either of you have a comment on that question that you wanted to share?
Nope, I think James said it all.
Concur with Sarah. I don't have anything additional to add on top of that. That was a great response, James.
Well, we have plenty more questions to get to. Jen, question directed to you regarding climate change impacts. We are already seeing climate-related migration. Any thoughts on refugee and migration climate change health impacts?
Thanks, Leela. That's a great question. I mean, of course, we'll see the impacts. We're seeing the impacts already, but I mean, things like heat-related mortality, disaster-related injuries, fresh water availability, food security, changing, diseases that people are being exposed to via migration that they may not potentially have immunities for. I think, relocation might certainly become necessary in some situations, and there are some limitations there that you need to take into account, like the high cost of relocation, or that, it could potentially deplete the resources of the host location. So success is really, I think, going to hinge on that support from those host communities, on making sure that there's infrastructure in place, that there are frameworks in place, education and employment opportunities in place, all of those kinds of things to really make sure that any kind of transition goes smoothly. Otherwise, there could be potential for additional problems to arise based on simple lack of resources.
Great, thank you, Jen. Question now, next question for Sarah. You mentioned some tweaking or changes needed for the Affordable Care Act. Could you briefly discuss what you see some of those tweaks or reforms would be?
That's a great question. I think that a lot of the attention, there's a lot of attention been paid to the fact that the subsidies that are available to people, to middle-income people buying plans on the individual market, are still leaving people with a great deal of out-of-pocket expenses. And it's probably part of the reason for the Act's, continuing unpopularity with some segments of the population. There are some technical reforms being that were talked about to figuring out payment rates and to figuring out ways to make the premiums more affordable. And there, of course, there has been a push for additional funding to try to offset it better. I think that that's, that is some of the most outward-facing types of issues that people are talking about, simply to make reforms that would address the affordability problem. And then there are a lot of, in a different direction, there's discussion about getting better data that's more focused on addressing the health inequity problems that are inherent in the health system, to really get down granular into the data to figure out how to get at some of these serious disparities. Those are just a couple.
Thanks, Sarah. Okay, we have the next question. What is HIAP? I can quickly answer that one. That's Health in All Policies. If there's any follow-up on questions on that, please enter it in the chat, but I think I'll move on to the next question. This one is, Justice Alito seems to think that the Constitution trumps public health measures. I doubt modern courts would decide in favor of smallpox vaccination, and Jacobson versus Massachusetts came before them today. James, do you have any thoughts on that?
Yeah, I've got a couple of thoughts, and I'll be happy to share them. But we also saw some interesting comments from Justice Alito just this past week that Jen and I had a very interesting exchange on. Jen, I may turn to you for any thoughts you want to share in that on just a moment. But let's be clear about one thing. No, I don't agree. The U.S. Supreme Court is not going to take on the facts of Jacobson versus Massachusetts, the seminal case involving smallpox outbreak and specific vaccination-related requirements, and reverse that or change that. There is absolutely nothing about what the court said in Jacobson that's any distinct or any different than what or how this court would respond today. Why? Because you've got to remember about what happened in Jacobson. It wasn't some compelled vaccination. It was a vaccine or face a fine. We do this all the time in the United States. It's called school vaccination requirements. There's conditions put on it. And as I've seen a little bit in the queue, too, about questions, will there be conditions put on COVID vaccine? You bet there will, but it may be by enterprises you don't perhaps suspect. So, for example, private sector healthcare employers and others may be more inclined to actually put specific conditions on employment related to COVID vaccine, but don't expect, even with a divided U.S. Supreme Court, some reversal of the Simano case of Jacobson. So we have seen some interesting comments from Justice Alito fairly recently. Jen, did you have any thoughts or comments you wanted to share to that effect?
James, I agree with you. I don't think that at this point the Supreme Court would be doing anything different in trying to get rid of that Jacobson framework at all.
Fair enough. We've had some interesting highlights of some of Justice Alito's comments very recently. We're watching all the Supreme Court members, including newest Justice Barrett. But to be sure, this court's sophisticated, as Sarah was saying. It can see through and read the tea leaves in relation to the ACA and understand its role as the preeminent constitutional body, hopefully saving it from further analysis, even under a severability sort of assessment. So, Leela, that's my take on that, to be sure. Additional questions forthcoming.
Great, thank you. There was a question about sharing a specific slide outside of the whole presentation. Before I forget, I'll go back to this slide quickly, and our email addresses are on here. If you want to contact any of us about a specific graphic or slide outside of the presentation as a whole, please feel free to do so. We are happy to answer additional questions or share that information. In addition, let's move on to the next question. Do you expect a mandate on using masks and getting a vaccine? I think we'll start with maybe James on that, and we can hear from the rest of the panelists.
I think we covered the vaccine question nicely just a moment ago. No, don't expect a government-compelled vaccination requirement. Don't expect that at all, but do expect potential conditions to be set on societal things you may want to do related to whether a vaccine is available to you and or you get it based on other factors, including whether you're a fit candidate for that vaccine or potentially have religious or other objections. Now, with that said, the mask mandate, that's gotten interesting, hasn't it? Because you're seeing some parlay back and forth in relation to whether Vice President, future President Joe Biden would actually issue a national mask mandate. He suggests he legally may not have the capacity to do it, but they're looking into it as we speak for the purposes of assessing how quickly, with available measures, even beyond the vaccine, we could quell this pandemic with a national mask sort of least requirement for at least public participation, notwithstanding what may happen within the private home. I'm not going to make a guess as to whether President-elect Biden would actually go that specific route fully. I'm going to say more and more states that do possess police powers sufficient potentially to make that stick might be looking at that specific route. The counts among the U.S. states within the hottest zones have gotten that profound. And it's got to come to an end faster than any vaccine can be distributed or produced in the United States, even if it is 95% effective, as Moderna suggests. I think you're going to see some additional mask-related requirements in U.S. society driven by states potentially with at least federal support instead of potential federal efforts to defeat those initiatives. Additional thoughts, comments along those lines would be interesting to hear, but that's where I think you'll see this administration go.
Thanks, James. If there aren't any further comments on that, we can move on, since we still have quite a few questions. Sarah, on this one is related to health insurance. How feasible would it be to align public health objectives relating to COVID-19 with private health insurance coverage? Example would be premium rates could be adjusted up or down based on whether the insured was vaccinated once vaccines are available.
Mm-hmm. So that's really interesting, and I will say I'm more in the Medicaid public world than in the private rates world, so I don't want to hold myself out as a super expert on that. But I think that every year when they're setting rates in the plans, both in Medicaid and outside of Medicaid, you need to take into account the historical costs and to adjust for the risks. I think it's going to be really interesting, and this actually is, I'm going to put a pin in this to go do some reading about this. How do they expect to see, this incredible aberration in care and expenditures for this year affect the markets going forward? And, that's just yet another, another reverberation we're going to see from this pandemic that's going to be really, really something to reckon with. Also, I have to say, I'm going to cheat while I have the floor. I forgot to mention something important that a reform that the Biden campaign talked about a good bit, which was the idea of eliminating the firewall that's a part, that's related to the Affordable Care Act, and that is basically a prohibition on people who are insured from buying coverage on the marketplace and sort of keeping people in their employer plans. One of the ideas is to knock that down and to have more competition with a proposed public option. And there's been various, speculation about whether that would cause like flight from employer plans or whether most people would stay put. So that's another reform and idea that's being talked about quite a bit.
Mm-hmm.
Thank you. Okay, to continue on our list of questions, I think we have time for a few left. Next question to James. Do you foresee financial support for people in quarantine as they return to work, or guarantees to return to work after quarantine?
That's a great point. We've been thinking about this and seeing some states move toward that specific direction, recognizing that it's kind of like with paid sick and safe time laws. If you don't have those in place, people don't have an incentive financially to actually engage in some of these public health interventions, especially 14 to 21 day quarantine periods, which will be very critical for at least one of the vaccines that has a 21-day lag period between the first and second dose. It might be actually quite pivotal that you remain in some state of assuring it leads no infection during that period of time. Some states have proposed on almost health justice related theories moving in that direction, providing some sort of reimbursement, be it through unemployment type reimbursements or otherwise, for that specific scenario. But I haven't yet seen, and mind you, we're closely examining some of what President-elect Biden's plan may look like. I haven't seen a federal push for that specific sort of deliverable. Some states, however, moving directly in that mode of thinking.
Thanks, James. Next question, I'll direct to Jen, and of course the rest of the panelists are free to join in as always. But this focusing on inequities. What is your outlook of COVID vaccine access at each state level, especially inequity issues?
Thanks very much, Leila. This is a great question. And one of the things that we've seen the most out of this COVID-19 pandemic is inequities, is health inequity. I mean, we've seen difficulties in accessing COVID-19 testing due to unequal distribution or lack of transportation, limited hours of operation. Also, vulnerable populations are more likely to be working in those frontline jobs considered essential, or to be living in those densely populated areas where it might be easier to get COVID. So what I'll talk about is, each state may handle this in a different way, but the National Academies recently proposed a framework for an equitable COVID-19 vaccine allocation. And this framework first prioritizes those healthcare workers and those first responders, then, nursing home residents, individuals with underlying conditions. So it has this kind of framework spelled out for targeted vaccine distribution. But the most interesting thing in terms of the equity sphere is that the framework suggests holding back 10% or so of that vaccine supply for hotspots identified by what's called a social vulnerability index. And so that can incorporate, race, poverty, housing density, among other factors, and really sort of get at the heart of the inequities and the disparities that we've seen magnified during this crisis.
Thank you, Jen. I know we are just right around the corner of time, and I want to make sure that we thank everyone for joining us today, and thank you all to our panelists. Great discussion here. We do have a few more questions, but if you want to follow up, please, again, feel free to reach out to us at the network. And some great questions we had today and a great discussion. Please see our website for more information about upcoming webinars. And thank you very much for attending, and I hope you all have a great rest of your day.